Well, this is an obstructive case in which you are seeing the uterus. This is the marked area is suggestive of the uterus. It measures 7.8 centimeters in longitudinal section, 4.6 centimeters in length, and this is the fetal head, and this is the cranium. So this is the urinary bladder. This is the fetal head, cephalic, and this is the cervix. This is the cervical region, and from here you can see that the uterus is seen depressed posteriorly by the cephalic position of the head. Now, how it came in my mind, or why there was a suspicion that this pregnancy appears to be extra-uterine, the reason was that, the reason I am going to tell you in a while, but I am sorry there is a lot of noise behind that of the generator, as we do not have the light as usual, and working on generator. This is the uterus, this is the endometrial canal, this is the uterus, this is the urinary bladder, and this is the head of the fetus. Now, the pregnancy is of 30 weeks, as biparietal diameter measures 7.6, that corresponds to the gestational age of 30 weeks. Going upwards. Now I am going to give a sweep to the probe from the epigastric region down. When I move the probe downward, it appears, and take a longitudinal section of the fetus, fetal body. It appears as if the fetus is stuck with the anterior wall. Now you see that this is the anterior abdominal wall. In fact, this is the fetal body, and the fetus is, this is the vertebral column. Let me magnify a bit. Now you see that all of the vertebral column is seen fixed with the anterior abdominal wall, with the rest of well, as expected, there is no outgrowth or outpouching from the vertebral column. This is the back of the fetus, the posterior back skin of the back of the fetus. This is the caudal end of the vertebral column, and see that it's in contact with the anterior abdominal wall of the mother. Now as I move towards the cephalic end, I see that all of the posterior abdominal wall, that of the fetus, is seen fixed with the anterior abdominal wall of the mother. Well, this is the cephalic end of the vertebral column. This is the body of the fetus. Here what you are seeing is the stomach bubble, and this is the transverse section of the, not a proper section. I am getting difficulty in getting the transverse section. This raised And what I was searching for and what raised the suspicion was that where is the placenta? And as I moved around, and I saw that there is a gap, this gap seen between this black area that you are seeing between the fetus and rest of the gestational sac, uterine cavity. So my patient was not having a full bladder at that time. I had asked her to fill the bladder. These are the facial structures. As you can see, the two eyes. This is the eye. This is the eye. There is no anomaly relating to the head of the fetus. Now if we feel ourselves being inside the uterus, then you can imagine that how the fetus will be placed. When the pregnancy is abdominal and not intrauterine. There is no anomaly seen relating to the neck of the fetus. This is the fetal kidney and aorta together. This is the aorta, this is the kidney. This one, right kidney. We saw the stomach bubble, that was normal. And the amount of amniotic fluid appears to be quite less, and the placenta is seen. Here you can see the neck of the fetus. Here you can see the cardiac activity. The cardiac activity shows regular waveform, and the cardiac activity is 150 to 153 beats per minute. So this is clear. This is the stomach bubble. You see, this is the kidney. This is the liver. This is the liver. These are the hepatic veins. So now let's see if there is any movement of the fetus. You can see the respiratory movement. I am keeping the probe still. You can see the movements of the fetus, but see that it is because it is fixed with the anterior abdominal wall of the fetus, of the mother. So the rest of the movements are seen, but the part which is in contact with the abdominal wall remains still. Rest we do see respiratory movement, and we also see fetal movement as well. Respiratory movements are also seen. There is no anomaly seen relating to the anterior abdominal wall, and the cardiac activity is seen normal. Now the amniotic fluid is less, and it measures only did we see the amniotic fluid? No, so far it was not visualized. So let us go through all the quadrants of the uterus. Here we are. Well, this is the placenta. This is the placenta. Grade 3. And then this placenta runs posterior to the uterus, to the fetus. Sorry. And is above the os. This is the placenta substance. Now the fetal bones are normal in calcification. This is the femur. This is the femur. So there is hardly any fluid seen in any of the uterine cavity, any quadrant of it. Then what is the status of the umbilical cord? Will be a question. Now, chasing the umbilical cord, you see a small rim of fluid is seen now. This is the fluid rim. This one. This is the fluid that is visible, amniotic fluid. This is the uterine wall. Bear with me with patience in this case. So far as the localization of the umbilical cord is concerned, we have to get it. I need jelly. Now this is a small, the largest fluid pocket that can be obtained, that of the amniotic fluid. in vertical section measures 2.7 and is too less for the age of the gestation. Like, कहना फिर नहीं पाना यार फिर वो इको कम होती है. Now if you concentrate, you will see that ultimately I am almost successful to find the umbilical cord. Okay, let me get the dorsal section of the abdomen. This is the dorsal section of the abdomen, and you should be able to get the umbilical cord somewhere here. As you can see that here we can see that this is the head of the fetus. Here this is the eye of the fetus. These are the facial structures, and this is the umbilical cord. This one, this small area. Umbilical cord is carrying normal throughout the one vein. Here we are. So this is where we can see the umbilical cord. It's supposed to be shorter in size in abdominal pregnancy, and thus it is. This is the umbilical cord. Now this is the small amount of fluid, amniotic fluid. These are the facial structures of the fetus. this is high. This is the space of the fetus. Let's concentrate on this region for a while. Facial features appear to be normal. Okay, let's proceed further. This is a study of abdominal pregnancy of 30 weeks with restricted oligohydramnioles, small umbilical cord, but nourishing the fetus in a proper way. They go normally relating to the uterus, to the fetus, and with placenta posterior wall. This is the placenta. This is the placental substance. So this is the placental substance. Going back again to the uterus, urinary bladder, and you can see the uterus being displaced posteriorly by the position of the head of the fetus. It's not easy really to go through all these parameters at 30 weeks gestational age. This is the uterus. This is the uterus displaced posteriorly. We really get it with a great difficulty, no doubt. This is the uterine outline. This is the urinary bladder, the fetal head. So this is a case of abdominal pregnancy. Thank you. Now, if you concentrate on this video segment, then you see that this is the cranium, this is the head of the fetus, this is the anterior abdominal wall of the mother. We do not see any uterine wall and amniotic fluid between the fetal head, and throughout the ultrasound we did not see the uterine wall surrounding this fetus and amniotic fluid between the fetus and the anterior abdominal wall. Placental localization is very difficult in such cases, as it can be adherent with the omentum, with the mesentery, and it can even go up to the vesico-rectal recess and even up to the right hypochondrium. So in this case, though we did see the placenta, and oligohydramnios, marked oligohydramnios is our hallmark also of these cases of abdominal pregnancy. And these are not easy cases to diagnose, especially at 30 weeks, So anyways, this is an ultrasound study of a 30 weeks gestational age, that of the fetus with abdominal pregnancy seen outside the. Now this area that I was saying you appears as a uterus is in fact appears as a mass. Now this is common finding to see that the uterus appearing as a mass and being labeled as a fibroid. Avoid this. This is in fact the uterus being pushed downwards by the pressure of the head, and the inside, internally the uterus is seen empty, whereas you can see the pregnancy being outside the uterus. So this is a form of an ectopic pregnancy. Thank you.